Hi YouTube. I'm creating a video response to Lucia WLJ. I hope I got that right. About all your concerns about surgery, and I'm 2.5 weeks post-op now, and I'm just going to go over some of your fears. A, the fear of dying. The likelihood of you not waking up from this surgery is slim. If you're worried about that, I would suggest that you talk to your doctor about their mortality rate. I know in Canada our mortality rate is something like 0.03% of people that don't wake up from this surgery, but it's generally due to other reasons. Like, I'm sure if you've been tested and you've gone through, all the pre-testing, I'm sure you're going to be absolutely fine. I know I worried about that too. I had all the same concerns you did before surgery, I can guarantee you that. Blood clots, I was concerned about that too. We had to do the needles for 10 days, and I'll tell you right now, they don't hurt. The worst part of the needle is when you push the medicine in, it stings a little bit, but actually inserting the needle doesn't hurt at all if you do it right, and they'll show you how to do it at the hospital, so don't worry about that. I didn't have any drainage tubes. I don't know why people do and people don't. I don't know what the difference is, but I didn't have any drainage tubes, so I can't tell you about those. As far as the tube down your throat, you won't wake up with that. That'll come out before you wake up, so when you're in recovery, that will be gone, unless you have problems breathing when you're coming out of the anesthetic. Then they might keep it in, but assuming everything goes alright and you're breathing okay, you won't wake up with that. That will be gone. Wound care. Wound care is, I didn't have to do anything. They steri-stripped my incisions closed. I did have a problem with one of my incisions where the steri-strip was tucked in the incision, so the skin didn't close properly, and I developed a little infection in there. But Polysporin took care of it. I didn't need any antibiotics, but they should give you antibiotics for the first day through your IV after your surgery. I know I got probably at least 3 or 4 doses of IV antibiotics after I got out of the OR while I was still in recovery, so you will get antibiotics afterwards to make sure that you don't get any infections. The wound care, you just leave them alone. They should be covered, excuse me, they'll be covered with gauze bandage afterwards. You leave them alone. Just wait. Don't take anything off. They'll tell you how to take care of your wounds. I took my gauze off after about 3 days, but then I still had the steri-strips holding everything together, and they stayed on for 12 days. I didn't take them off for 12 days. And I would show you right now, but maybe I'll do a private video for you that I don't post here, but my incisions are fine. Post-op pain, I'm not going to sugarcoat it, it sucks. It's not the incisions that hurt, it's the fact that they have to go through muscle, and I don't think that they're very gentle when they're doing the actual poking and prodding with the scopes. I'm assuming you're having it laparoscopic. I don't know if anybody does it open anymore. I don't know. If you're having it open, you'll have one large incision, but if you're having it laparoscopic, you'll have several little ones. It's the muscles underneath that hurt, because those muscles are stitched back together as well. My major issue is on my right side. It's still sort of sore 2.5 weeks later, but it just feels like someone punched me in the stomach. So I can move, I can, all that kind of stuff. You're going to have to learn to use your arms to pull you up and get your legs underneath you when you're trying to stand. Try not to use your tummy muscles when you're sitting and standing and laying down and that kind of stuff. I needed help to get in and out of bed, so my husband would help me. He would hold my arm, and I would just lower myself into the bed while I held his arm. It gets better every day. My pain level, even from a couple of days ago, it's so much better now. It gets better every day. Keep your fluids, get your fluids in, and get as much of your protein shakes in as you can, or whatever they have you on afterwards. That will help you heal faster, and that will keep you strong. So keep that stuff in you, getting that stuff in you. Walk, walk, walk. That gas after surgery, you're going to be full of gas. The gas afterwards is very painful, and to keep that moving, every once in a while, you'll sort of feel it coming up under your ribs. And if you walk, it will help it disperse. It will help keep it down, because the gas wasn't pleasant either. You have all the same fears as we all have. I guarantee you that. You're not alone here. But just know that you will feel better. I'm only 2.5 weeks out, but since I started my OptiFast on May 14th, in 1 month I'm down 38 pounds now. And my diabetes is gone. My blood pressure used to be, it wasn't high, but it was getting there. It was sort of on its way to the high side. It's gone. It's completely normal now. My feet don't swell anymore. Honey, it's worth it. It is so worth it. You're in for a couple of weeks of hell. I'm not gonna lie, but it's gonna be worth it. You'll forget all this. This is just a blip. You'll forget all this, and then you're on your way. So yeah, be worried, but don't stress yourself out about it, because really, you're gonna be fine. You're gonna get through it. Use the pain meds. Use the pain meds. That will help make life easier in the hospital. And just take your time and heal at your own rate and get strong on your own rate. Just do what they tell you to do. Alright? Hope all is well. Hope that helped. You're in for a ride, honey. You're going to do great. See you soon. Bye.